We're the center county of the Panhandle, the right in the middle. We're probably the hub for the Panhandle of support, but Texas County, we utilize Kansas and Texas as easier than we do Oklahoma. So our demographic are pretty independent. They try to get their own needs met without asking anybody for support. We have a very diverse population because of our pork processing plant. And
we're one of the most culturally diverse counties in the state of Oklahoma.
We began in 1991. We were actually the Turning Point grant, the original Turning Point grant. And so then we've just continued to organize, promote, meet since 1991. Texas County always has its unique challenges because of our distance from the state. Our IT is different than Metro IT. We had quite a few barriers in that pilot program, but I think it taught us all about how to overcome some of those barriers when you're in rural areas. Platforms are kind of new to me, and I understand their benefit, and we had the opportunity to experience it and run the pilot.
So MTX is the electronic platform that we originally tested for the state to cover the COVID testing event, the catch-up event.
Yes.
So that platform allowed us to have ease of entering the patient's information and testing. It helps coordinate easier in electronic format. So the whole environment and has changed around, and especially here in Texas County. We are one of the rural areas, so we're not in an urban area. We don't have as many people here. There's not as much traffic, so the virus numbers are not as high as you would see in a larger urban area. So that leads our community to feel like it's not as much of a needed.
Our community isn't as scared.
Yeah.
I mean, it's unfortunate, but I mean, the attitudes here are different, and we are, even though we have a pork processing plant, we have had really high numbers. Texas County has been, but people, I think our general average population, those ones that have been here forever, don't think it's their problem, right? It's a problem of somebody else. It's the people working in the plant, or it's the people that can't get health care, or it's the, and so there's a real, I don't know, maybe other people in the state are, but it feels like we're defending or trying to impact attitudes as much as we are about healthcare and about COVID testing, and which is what the coalition is, right? We impact attitudes all the time, or we try to impact attitudes all the time. But
so the education piece with COVID has turned out to be one of the more important things that we can offer to the community. Not just the testing, but the actual education and information behind it, and why it's important, and why, even though they do feel like we're an isolated rural area, that it's still an important piece for our area.
I believe in grassroots organizations. I believe that our community should have a voice and direct the money that comes into Texas County. For years, people in Texas County, we felt kind of out here left alone, not supported by our state, and things that work in Texas County don't work the same in Tulsa County, in Oklahoma County. And so this is our way to have a voice, to direct the funds that are coming down from the state and federal levels to make an impact on how it makes sense in Texas County. And that's why I have stayed, and that's why I do what we do, because it feels like a way to make it make sense in Texas County.
We're not just here to do COVID testing. We've been here for a long time, and we're going to continue to be here to help improve the healthcare of Texas County for all of our residents. So that's one of the main things that we're so excited and so happy to be a part of this, and to be awarded. It's wonderful that somebody can recognize our drive to improve healthcare in our area. We're currently working on a mental health improvement project, so we're hoping to have some movement in that area. here in Texas County. So I think it's just continue to see what opportunities arise and what areas really develop for us. There's going to be areas that improve, and there's going to be areas that we're going to see that need improvement. And I don't think that, I think it's something that we just can't stop on. You know, we're just going to have to continue to develop this area and push and strive towards the goal for us.